Morning viewer, Viandas here. Here is a breaking news for our viewers. The House of Lords is being urged to throw out plans for non-doctor associate roles to be licensed by the same body as doctor. Under a planned new law, physicians associates, that is called PAs, will be regulated by the General Medical Councils. The British Medical Association believes this could lead to patients confusing the different roles, which it says could have tragic consequences. The Department of Health and Social Care has been approached for comment. There are about 3,200 PS working in GP surgeries and hospitals in England, with 10,000 more planned in the next decade or so. They were introduced to help doctors with their work, examining and diagnosing patients and discussing treatments with them, although PS are currently unregulated. Unlike doctors, they do not have to hold a medical degree, but they usually have a degree in a life science and have to undertake a 2-year training course. The BMA, the union representing doctors in the UK, believes that regulation by the GMC could lead to a bloody PS and doctors. In an open letter to the House of Lords ahead of a debate on Monday, the BMS chairman, Professor Phil Banfield, said PS are not doctors, they do not hold a medical degree and are not medically trained, despite misleading statements made by some. We know that patients are already confused about telling the difference between PS and doctors, and these legislations will make this problem worse. Keeping the GMC as the regulator exclusively of doctors would mean we retain the clear distinction between doctors and PS. The BMA believes PS should instead be licensed by the Health and Care Professionals Council, which regulates other medical professionals such as paramedics and radiographers like the GMC, and the HCPCS function is to set standards, assure quality and investigate complaints. Under the same order, anesthesia associates working in this NHS would also come under this regulation of the GMC. AS helps anesthetists and should be supervised. An NHS spokesperson said physician associates play an important role in supporting the NHS to provide high quality care for patients, but this should always be with appropriate supervision and within the scope of their practice. Bien, the report.